As a female urology, we are just only 10.1% for the last census. Female urologists here practicing in the United States. I see that it will grow in the future because there are a lot of females that are getting in the medical schools and probably getting in all these surgical specialties. But as a female in urology, nowadays, during my interviews, I was pretty surprised how many groups and hospitals they really want you. Some of my interviews, they say, oh, you are like a unicorn. Everybody wants you because you are a woman, you speak Spanish, and here, basically in Florida, like everybody wants someone like me in a practice. As a female, you have to be sure that how you want to build your practice, because a lot of times when you go for a job, they just you just want to see female and you just want to do your specialty in female urology. That is one of the things that you have to be pretty clear how you have to build your practice, and be sure that you say, okay, well, as a female, yeah, if you are a general urologist, you can say like, hey, I'm not just seeing females, want to practice general urology. I also see men's and different kind of pathologies.
So how is it dealing with men? Urologists mostly a male-driven patient population.
I can see in the old population, sometimes it's kind of difficult for them to accept that as a female you are a urologist and you are sometimes you introduce yourself, hey, this is Dr. Nicholson, I'm your urologist, and they ask, oh, and you are the one that will do my surgery, or you are the one that will treat me. But I don't see that too much in the young generation. It's more normal seeing that urologists and women can be surgeons, that paradigm that happened before, that only men were here. And I think that it will change with the time. But yeah, you face that sometimes and you said, yeah, we are women, we are surgeons, we do this, and yeah, and you're a urologist, I can do this too.
So why is Florida one of the best places for a female that's a urologist to practice?
The population here is pretty mixed. It's a lot of people for another countries, and also depending on the city where you are, it's a lot of young people. So it's pretty normal start to see that it's not different in sex for your career as a surgeon, and they're accepting pretty well. And for me, basically, that I'm coming from another country that I speak Spanish, a lot of times your patients feel more comfortable when it's a health issue, be able to express themselves in their native language, and they can feel more comfortable and they can, express more better, and you break that communication bridge that sometimes exists. I think that is pretty important.
So if you had a Spanish-speaking patient in front of you right now, what would you say to a guy that's dragging his feet on his health in Spanish?
Well, depend of the culture, I always ask, what do you want to speak? Do you want to speak English? Do you want to speak Spanish? A lot of times they say, oh, just speak Spanish, and they start to feel so comfortable with you. You feel the difference when they speak the native language and how they express and how they feel more comfortable.
How do you say, just do it?
You say, well, esto es lo que está pasando contigo y esto es como tenemos que hacerlo, y probablemente necesites una cirugía. That is how we say it.
And last question, how important is it to have the partner involved in patients that are of Hispanic origin or Latino origin?
I feel that it's pretty important because the Spanish culture is pretty family-centered, and this is why a lot of times in the hospitals and everything, you go to the room of the patient and you found like 5-6 family members in the room. But it's part of the culture, and everybody wants to know what is going on with your patient, and everybody's worried. You learn how to manage, you explain the whole family at the same time. Of course, is your patient, allowed to do that, and the family feel good. You are really taking care of the patient.